Hello and welcome to everyone who has joined us on this session today. You've probably just heard me ask my colleague Meg to press record. So just to let you know, we are recording this session. This is so that we can share it on the HFMA Finance website as part of the Midlands Finance Academy, so that other people who maybe couldn't make the session today can hopefully watch it back and see the information. But obviously just wanted to let you know, so we'll be doing a Q&A at the end that we're going to record this for sharing. And if anyone has any questions or concerns about that, then just pop a message in the chat. So welcome to the session today. So the purpose of this is to give you some more information about the qualification that the Midlands Finance Academy is offering a bursary to for people who are working in NHS finance in the Midlands. So this is a master's level qualification that the HFMA have been running for a number of years, which you may already be aware of. And now the regional finance academies, which includes the Midlands, are offering some funded places to be able to undertake the qualification. And we're going to have a sort of an overview of what the qualification is and sort of what's involved, and then we're going to hear from one of the tutors who runs one of the modules, Paul Dillon Robinson, with a little bit more detail on his module in particular, and then we're going to hear from John, who's a sort of former student, on his experience, and then we'll have time at the end for any questions. We'll run a Q&A. So I will hand over to my colleague Emily, who is an Associate Director at HFMA and heads up the Academy work. And she's going to give us a sort of an overview and introduction to the qualification.
Thanks, Becky, and morning, everybody. Really good to see you all. So I'm just going to do a really quick introduction to the HFMA Academy before handing over to Paul, who will give you more of a flavour of one of the qualification modules. If you do have questions, do pop them in the chat, or I will be around at the end for the Q&A as well. So if we could just go on to the next slide, Chloe, please. Thank you. So the Academy is an online study centre, and it was set up in 2016 to deliver purely online qualifications. So since setting up, the Academy has supported over 600 learners to complete certificates and diplomas during this time. And we offer two master's level qualifications. So one is our diploma in healthcare business and finance. Sorry, Chloe, just pop back again. I'll let you know when to move on. It's always hard, isn't it, moving on the slides for someone else. So one's our diploma in healthcare business and finance, and then the other is our diploma in advanced primary care management. So previously we actually ran the two qualifications separately, but a year ago we were really keen to have system-wide working at the forefront. So all the learners have been brought together to study as one group, which has been a really positive change. We've got a partnership with Northampton University, where anyone who completes two of our diplomas can then go on and complete the final third of an MBA with Northampton. Okay, so on to the next slide, please. We've got a...
Just point to, they are automatically changing, that's why.
Oh, are they? Oh gosh,
yeah.
I'm not sure of the speed here then.
Yeah.
Okay. Thanks, Chloe. So we've got a range of modules available as shown on the screen here on the left hand side. So diploma is made up of two modules. They're 30 credits each and therefore 60 credits in total. So if you're doing a certificate, you'll get 30 credits upon completion, and you can choose whichever one you'd like to do. And choose one for a certificate, two for a diploma, and then as mentioned, you can, after successful completion of two of the diplomas, you can then go on to the University of Northampton and complete the final stage, which is a year, and you do essentially a dissertation, which can be related to your work, and it's a nice research piece that you can then use and sort of as part of work within your organisation. So then on the next slide, if it will move on, it will show the qualification pathway. So just on here, just gives you an idea of kind of the pathway that you could potentially follow if you were wanting to go on to an MBA. So stage 1 is a diploma, so 2 modules for the 60 credits. So that is available to any healthcare professional who can demonstrate that they can work at a master's level. Or for stage 2, you can do your diploma, which is worth 120 credits, and that is available to those who are qualified accountants with 2 years experience working in healthcare. So essentially, if you're already a qualified accountant, you've got 2 years experience working in healthcare, you are exempt from the first diploma. So you would only need to do 1 diploma to earn 120 credits. So effectively, if you're wanting to do an MBA, you could get this done in 2 years. That is if you're a qualified accountant already. If you're not, then you would need to do stage 1 and stage 2, then the final stage. And it's all, you know, it's very much up to you what you'd like to do. Some people do a diploma, give it a year or so, come back and do their second diploma, and then they may go on to the MBA. Some people choose just to stick with 1 diploma and not go through to the final stage. Some people just do 1 certificate. It's very individual, and depending on sort of where you are and where you want to sort of go in your career. So then the next slide is on the module structure, and apologies that we're just showing it this way rather than it jumping ahead. So in terms of the module structure, each module is 17 weeks in length. So this includes pre-reading and preparation, an introduction to the module session, and 10 topics of learning which are delivered over 10 weeks. So you would get a copy of the module timetable, which is sent out in advance, giving you further details of how the module runs. There's also a couple of study breaks included within the module, as well as an opportunity to submit a formative assessment, which basically gives you the chance to submit an assessment plan or a short piece of written work, and therefore gain feedback from your tutor before you begin work on the final assessment. For quite a lot of people, you may be new to study, or you may not have studied for quite some time. So it is quite daunting at first, and getting your head around working at a master's level isn't easy. So we do put a lot of support around to help you with this. In fact, we've just introduced, as of this current cohort, a critical thinking workshop, which took place sort of midway through the modules that just happened this week, which was very well received, and a real help, I believe, to learners who are trying to get their head around thinking more critically, which is a bit of a skill. And once you get it, it does get much easier. So as I say, so you've got to submit an assessment as part of your module. So the type of assessment will vary from module to module, and with the aim to play to different people's strengths. So examples include maybe a written essay, a video talk, a reflective piece, or a PowerPoint presentation. And as I mentioned, we've got a number of guides to support you with the submission, and also how to reference appropriately. All the assessments go through a very thorough marking and moderation process, and they're all marked anonymously. And if for any reason you were to be unsuccessful in passing your assessment, you do have the opportunity to resubmit. And what we would do at that point is really encourage you to seek support from your tutors, because we very much want you to succeed just as much as you do. So there is a whole host of support around the assessment to help you be successful. And on successful completion of the diploma, we then invite you to attend the awards dinner and ceremony, which takes place, in fact, it's taking place next week in London. And then just on the next slide, we've got some lovely shots of our wonderful tutoring team who have worked with us for a number of years. and have a whole host of experience. And Paul, you will hear from very shortly. And then in terms of the next slide, you can just see here that we offer 2 study intakes per year. So if you were to be utilising the Midlands bursary, you'd be looking to apply for the next intake running is March, or there will be one running again in October of next year. And those are the modules that will be running at that time. And then on the next slide, so I've kind of touched on quite a bit of this as I've gone through, just in terms of what you've got access to. So the support from our tutors, you will have access to our online learning environment 24/7, so you can access this via your computer, your tablet, your phone. You've got the weekly live evening sessions, all of which are recorded, just in case you can't attend. Lots of guidance on the academic study skills. There's the study breaks to allow you to catch up. And another little perk is you would receive if you wanted to, you could purchase a student card, because of course you would be a student, and receive the discounts associated with the student days, which is really, really helpful. The other thing just to mention is that by registering on the course, you'd also get, if you haven't already, but you would have free membership to HFMA. So you can have a look at some of the other things that we offer, which is really helpful whilst you're on programme, and also access to an extensive network of people who you'd have the opportunity to connect with. So that's a little bit, a real kind of whistle-stop tour of the qualification and our online learning academy. The next couple of slides I won't read through, but they just give a flavour of why study an HFMA qualification. But in fact, I think the better thing will be to hear from John, who has lived it, breathed it and survived it. And the following slides are just a little bit of feedback from students. I think, Becky, these slides will be available after.
Yeah, so there's been a question about whether the slides will be available. So Meg will circulate the slides to everyone after the session, and as I said in the beginning, we're going to pop a recording of the session on the website, so we'll make sure you've got access to that as well in case you want to watch it back or share it with any colleagues.
Brilliant, thanks, Becky. So yeah, so you can sort of read them at your leisure. I will say that the qualification, it's a time commitment, and that's often the barrier that people come up against when they're deciding whether or not to sign up. And you do have to structure your time to be able to, commit to it. But those who do commit and do complete their certificate, their diploma, they always come out smiling, and they're always, really pleased that they've got to the end. And yeah, I mean, you'll probably hear a little bit more from Paul on that, and certainly John too. And it is a real achievement. It's not an easy qualification, but there is an awful lot to learn. And the feedback that we've received from our learners has consistently been very, very positive. And we'd be very happy to put you in touch with learners if there were any specific questions you had that you might want to ask them. So that's everything from me for now. As I say, I'll be here for the Q&A at the end. And at this point, I guess, handing over to Paul.
Thank you, Emily, and for that. And let's see if the slides will keep up. So Chloe, if we move on, so a bit of background about myself, hopefully, is so I'm a chartered accountant, and I did 17 years in the NHS. So unlike the other tutors who are very, very important, very often the directors of finance, I was just a humble head of internal audit across a whole range of organisations. But I did spend 8 years as managing director of an internal audit consortium, which is now part of TIA. Probably more appropriate to this is I actually did my MBA with the Open University a few years ago. And I always tend to say that my last paper was when my youngest son was born. So I do have some bitter memories of working, studying, and having a young family. And I love doing my MBA, but it was, as Emily has said, these things are hard work, but worth doing it. When I was in the NHS, I was active on governance, risk management and audit, involved with the ICAW. And after 17 years in the NHS, I thought there's got to be life outside the NHS. So I went to the House of Commons as the Director of Internal Audit, just as the expenses scandal broke. So I had a very interesting time in the House of Commons. And then about 6 years ago, I decided I'd really had enough of politicians. And so I'm now developing I think a portfolio career is the way we talk about it. So at the moment, I've got 3 non-exec roles in the public sector. One is within the NHS. I do consultancy works in the education sector. And because I've been involved with the HFMA when I worked in the NHS, when they heard I was footloose and fancy free, I got a tap on the shoulder. And I do quite a lot with the HFMA at the moment. So Chloe, on the next one, you'll bit of background to this, hopefully. So when I worked in the NHS, I was involved with the HFMA both in terms of the Kent, Surrey, Sussex branch, but I also chaired the Corporate Governance and Audit Committee. I became a trustee. I authored the original guides on governance and audit committees. So I kept in touch. And then when they heard I was looking for some work, they said, "Oh, Paul, we've got this operating game. I think you might be quite good at helping facilitate that. Oh, Paul, by the way, could you run some training? We've got some on, say, preparing for leadership or working with auditors. And can you write some guidance?" So for those of you who had to fill in last year's financial sustainability checklist, sorry, that's my fault. I didn't know it was going to be mandated, but I did help write it. And I'm currently updating the Audit Committee handbook. I do some coaching. I've been involved with 1HS Finance, Future Focus Finance. And then they nabbed me about 5 years ago and said, "Paul, would you like to tutor?" And so I tutored on L703, which is tools to support decision making. But the one I've been leading on all this time is actually L701, which is managing the healthcare business. So as you can see, I keep myself out of mischief. So what is this about? This is really it sort of describes itself of how you plan, report, and govern, if you like, to manage a healthcare business. So this is the, if you like, the wider aspect of it and behind it. So we're looking at things like financial planning and budget management, financial management. We look at annual reports and accounts. We look at governance and we look at risk management. But it's very much at the high level. So for a lot of the people who come on to the learning, if you've not been involved at sort of like the board level, this is quite a good introduction to the high level of managing the healthcare business. So we're not involved in great detail. And for a lot of non-finance people, they quite like this because there's not a lot of numbers to crunch with. But as with anything on Masters one, it's not a question of how, it's more a question of why. So that's the broad things that we're trying to cover within it. Chloe, next, please. And the topics that we cover, I basically divide it into 3. So the first 4 weeks, or the 4 modules, are around governance and risk management. And what we're looking at is particularly the difference between governance, which is how you direct and control an organization, and management, the actual day-to-day running of it. We look in some detail at regulation, and then the key word is effective management and governance. So what you're trying to learn on these is it's not just a question of, here are my standing orders and standing financial instructions, but why have I got them? What makes them work? What makes them effective? And then we also look at risk management, and I will emphasize the importance. It's got nothing to do with risk registers. It's actually about managing risks. And we're trying to look at the pros and the cons of those behind it. We then go into a 5-week stint on, if you like, on the basics of financial management. So we start with the whole concept of business finance, and we look at the business planning process, so operational and strategic planning. Then we go down to financial planning. We sort of follow the cycle through to the annual reporting, and then into treasury management. And a number of people think, oh, cash doesn't matter. And you have to say to them, yes, cash does matter. And again, in looking at that, we're starting to challenge of this is the way it's done, but why is it done this way? Is there a better way of doing it? What does good look like behind that? And then the last week, we bring it all together in terms of financial sustainability. Because ultimately, if you're looking at managing a healthcare business, if you're going to be a sustainable business, then you need to have embedded good governance. You need to have embedded good practice and work properly. And that's the real challenge behind it. And I'm referred back to that checklist. You can tick the checklist. But what we're really challenging is, what does good look like? What does effective look like? What are the real drivers behind it, such as culture, such as behaviours, as well as that side of things? So those are the topics that we cover in the 10 weeks. So Chloe, moving on, please. And when you look at the structure behind it, so you have what we call the ebook, which you read through, and is written by people with a lot more brains than me, and they will go through. And what I suggest to people is you skim through it first, and then you do a detailed read. And sometimes it'll say skim this this article, or it might say read this in detail. And what you'll have is some sort of academic models behind that, or you might have some get best practice, or there might even be some sort of knowledge information that you need to pick up behind that. So that's the sort of the depth of what you need to do to have a look through there and get an understanding. Within that, there's a chance to what they call a reflective journal, which is a chance for you to make your notes, but also just to prompt you to think. And the bad news, if you like, at working at master's level is that your brain does need to engage on this one. For those of you who've qualified as an accountant or been through sort of exams before, very much this is about showing your knowledge. It's about showing your understanding, and therefore the reflective work is really important. So I encourage people to do that. You can do your own notes, but these are your own ones. There's also a discussion forum. And what I tend to find is most cohorts have a mixture of people. So we tend to have a number of finance people, but what really works is when you've got some clinicians in there, you've got some operational people, you've got some from primary care. And that's where you use a discussion forum on a topic to share your experiences, but also to practice your academic skills in terms of critical evaluation, critical analysis. And what I tend to do is post them, and I try and put some subtle hints in about what, if you break down the question, what is that question trying to look to? Really encourage people to be involved and to do that. It just takes the one or two to start it, and everybody follows. In terms of the time frame, so this next L701 will start in March. What I try to do is to chat to each learner before the start. Last time I actually had 25, so I had quite difficulty catching up with them. But as a tutor, and I think all the tutors are there, we're there to help you. We're interested because, if you like, we've come to the end of our careers and we want to give back. But we need to know you a little bit about what you're looking for, where your circumstances are, and where we can help you. So I think that's important. I've then got Thursday evenings up to the end of June, and there are those 2 study breaks that Emily mentioned, and they last for 90 minutes. So I tend to tune in a bit early, have a chat, and I stay around afterwards just to talk to anybody who's got any problems around it. But what's really important is, and all the tutors will say this, we're just one email away from a Teams call. And that's really important from our point of view. We're here to support you at other times, particularly as you get close to doing your final assessment. So moving on, please. So what happens in these live online sessions? So they're on a thing called Big Blue Button. So it's similar to Teams. And what I tend to do is ask people, anything come up from last week that you've thought of? Normally, I absolutely get no response whatsoever, but at least I offer that one. I then do a very brief teaching on the basics. I'm hoping, and I would really encourage people, that you've read the ebook before you come to the Academy live session, just getting that discipline in place. But I'll just go back to make sure, what are the key models? There are probably 2 or 3 models, or 2 or 3 really important themes in each one, just to make sure we're really up to date. I then do my own piece of independent research around the topic. This is really critical as we go into the academic style, that you start being curious. Now, Wikipedia is not the fount of all knowledge, but it's worth a start. But there are various other academic databases, and I'll show some of the things you can do about how you look around and do that and something that's relevant. And some of them may be really strange. So my favorite one when I'm looking at business planning is the gardener, the craftsman and the scientist or the engineer. And it's talked about different ways that people approach. But then I might do some research, which is very detailed from NHS England. But that's an important one. We then probably have one or two breakout sessions where you go and discuss amongst your colleagues around a question, and each will take a turn in sharing and people will feedback. I then do something on academic pointers. What is critical evaluation? What is critical thinking? How does the Harvard referencing system? Just to really help you. Now, whilst there's lots of guidance out there, let's be honest, one or two of the learners may not have read all the guidance in advance. I'd recommend it, but they don't do it. And then as we go through, I'll start taking apart the assessment on each one as soon as it's been issued, so we can start talking about the assessment and getting rid of some of the worries on it. In terms of study time, the Academy probably says it's sort of 12, 13 hours a week. I would suggest you allow at least a sort of a day a week. And then as you get towards the assessment, it's about focus time. But what's really important is that quality time is better than quantity. So I get learners who say, oh, I'm going to put aside Saturday. Saturday comes, the sun's shining, they're sitting there, they're looking at the ebook and nothing is going in. So I think actually a half hour, 1 hour burst is the much better way of doing it. Absolute focus, go through and do it, have a break, go back, do a bit more. And if that works or whatever works to you, but what may have been your study style in the past when you were a full-time student may not be the same. And I absolutely appreciate you've got family to balance and things like that. So what's really important, you have to do the reading, but you have to do the thinking. And that's a critical thing you need to go forward. Next one, please, Chloe. So the assessment, we're looking at it again at the moment, but at the moment what it is, it's in two parts. And as Emily said, we're trying to do different ways of showing it. So first of all is a report. And what you're looking at is they call it a critical evaluation of the financial situation. We've got an organisation in financial trouble. Take your pick of which one you want to do. But what's important at master's level is what's called this critical evaluation. You need to look at both sides of the argument, the pros and the cons, and then come to an evaluation. You then have to evaluate the importance of the role of the board in effective governance. So it's not just in governance, but what makes an organisation really work well, and is it the board or it may not be the board? And then looking at risks. And then the presentation is an action plan to address this. So what you're then trying to do is pull out where is the good practice. So whether it's the Lord Carter review or whether it's GERFT or whatever, you're pulling those out and saying, how can I then apply that? What you're really doing here is important, is you're assessing, or what you're being assessed on what you've learned from studying the module. So sometimes I get accountants who say, oh, I know all about it, and I'll write it based on my previous knowledge. But that's not the point of this one. It's a master's level qualification, and therefore it's the academic challenge of, well, what are the alternatives? And having said already, I always go through parts of the assessment. I try and dissect it just to make sure and link it to the learning. Chloe, final slide, I think, coming up. So what makes us successful? It's been said, and I stressed it, but this is actually master's level. So whilst there's some things where you'll go through and say, well, I didn't know that, what we're really trying to help you is understanding why not, what if, what so. And that's the academic challenge, so that if you like, you're not just doing what you've been told to do, but you're really understanding it. And it's this critical thinking, looking at both sides of an argument, not just being critical as in destructively critical, but let's actually look at the pros and the cons. As someone said to me the other side, both sides of the coin. You will have a cohort of learners with a wide range of knowledge and disciplines and experience. So if you want to get the most out of it, really use that. So my last group had their own WhatsApp group. I wasn't involved in it, and they could contact each other. And someone said, well, I actually know about this area and this can support you. Or does anybody have any background behind that? So it's a useful way of doing that. Independent research is great. I actually think it's quite interesting, and you can go down rabbit warrens, because what you tend to do at this level, it's about depth, not breadth. So you really can take a theme and work your way down to really quite detailed. I did have one learner who got into the maternity services in Azerbaijan as an example. So that's the sort of level you can go down to. It's also a real opportunity if you talk to people in your organization. If you don't know something, why not go and talk to the director of finance or your CFO and say, look, I'm studying. I wonder if you could help me in applying my knowledge. And it's amazing how often they'll say, look, I can give you half an hour. Or someone else, I can give you some time. So the more you can see how the actual studying fits in, it's a really good excuse. And finally, we're here to help, and we're keen to do so. So please use them. I think that's my final slide. And so I think we're all going to a general Q&A rather than just specifically for me. So thanks for
Paul.
listening. Yeah.
Thank you. Yeah, I mean, if anyone's got questions for Paul, obviously you can pop them in the chat and we'll pick them up at the end of the session. But we're going to move on now and just hear from John before we have the Q&A. So hi, John.
Hi there. Yep, I'm John Leaper. I'm an Assistant Director of Finance at North Cumbria Integrated Care. And I suppose my involvement with the qualification goes back to the very beginning. So just to set it in a bit of context, so the word integrated in my job title, there were obviously been a bit of restructure in the NHS. So previously in Cumbria, there was an acute provider and a community and mental health provider. And I was working in community and mental health, and I could see that there was change coming. And I'm sitting there and thinking, well, there's somebody else at the other provider who's doing a very similar job to me. You're looking at the senior team. We're all qualified accountants. We've all got similar levels of experience. And I was thinking, what can I do to set myself apart in the coming merger? So as a good timing, the HFMA were thinking of launching qualifications, and they were looking for students to pilot them. So I joined up and piloted one of the first modules, and yeah, enjoyed it so much I kept going and did another couple and did the full qualification. And then I must be a glutton for punishment, because I then kept going and completed the MBA as well. And then even then I wasn't quite finished with the HFMA qualification, because I applied to join the Qualification Assurance Committee. So I'm also on the committee that ratifies the results and looks to improve the qualification going forward. So yeah, I've very much enjoyed my time and keep on going with HFMA. So I suppose thinking about the qualification itself, I did my professional accountancy qualification distance learning, and that involved basically being sent 3 or 4 books and then showing up to an exam 6 months later. And when I heard the HFMA qualification was distance learning, I was like, is that what it's going to be like? And it absolutely wasn't. I suppose I should stress at this point we're talking about pre-COVID, so this is pre-Microsoft Teams, and people weren't quite used to this way of working. So the interactive sessions were all really good. At that point, everyone kept their cameras off. So it was this: the tutor had their camera on, but the rest of the room didn't, because we weren't quite used to it. There was an amusing example. Some of the students, we were down at Rochester Row, HFMA in London, and there was maybe 20 or 30 people in reception. I was like, I know there's 5 or 6 people on my course in here, but because we never put our cameras on, I don't know what they look like. But I had to wait for people to start talking, because I recognised their voices from the interactive sessions. But I think now, after COVID, everyone's a bit more used to keeping the cameras on. So I think, yeah, the other people on the course are the valuable resource. I know there's the ebooks and everything you learn, but it's everyone on the course. Certainly I was working with people, different parts of the country, different organisations, commissioners, providers, regulators, auditors. Had some clinical colleagues, a doctor, a pharmacist. They had a very different perspective that was very useful. Also, there was a colleague, I think he was London Ambulance, and he was saying John, the average speed of an ambulance in London is 2 or 3 miles an hour. Even if the next hospital's 3 miles away, it takes me an hour to get there. I was like, yep, up in Cumbria, we might manage to do a bit faster speed, but the next hospital's 40 miles down the road, so it still takes an hour to get there. So it's just a different perspective on things. On the list, yeah, just the impact of the study and how that changes. So I think the key point of the master's level is the critical thinking. So it's the why behind things. So when you're not learning something to repeat it later, it's not verbatim, it's all critiquing the models. So it's about thinking around the topic as discussed. And I think that's what's, when you're going forward, in effect, you don't become the director of finance by being the best technical accountant. The skill set is always wider than that. It's the extra things. So you're broadening your skill set by doing the qualification. I think that's really important. And again, the amount of time you have to put into it, it's not like doing your information governance training once a year, which takes 5 minutes and you move on. Actually, there is quite a time commitment to this, but once you get to the end of it, the sense of satisfaction is also quite a lot greater. And obviously, if you reach the end and get an MBA as well, that's yeah, I'll put it on the wall behind me. But yeah, it's definitely worthwhile doing the qualification. And I think that was pretty much everything from me.
Thank you very much, John. So just quickly before we kind of move on to a chance for any questions, I'm just going to talk quickly about the Midlands Finance Academy and kind of the specific opportunity that we have. And apologies as well, I should have introduced myself right at the beginning of the session. My name is Becky Vine and I'm the Programme Manager for the Midlands Finance Academy. So what we have is 12 funded places that are available. So the reason there is 12 is that we have 1 place per ICS in the Midlands, and then we also have 1 place, which is a kind of a regional place, which we said could be taken by either the NHS England regional team or one of the CSUs. And these funded places were for the October 2023 cohort, which is obviously just passed, and then the March 2024 cohort coming up next year. We have had some of those places have been taken in terms of people have applied and started on the October intake. So those are Black Country ICS, Lincolnshire ICS, Shropshire, Telford and Wrekin ICS, and then also that regional place. However, if anyone is on this session today is from one of those areas and is really interested, please let me know, because we will be looking to provide more funded qualification places through the Academy in future years, just subject to kind of the funding that the Academy gets from the ICBs in the region. So yeah, get in touch with me. I'll pop my email in the chat and let me know that you're interested. And then what I will do is add you to a waiting list, which will give you first priority on applying for any of the kind of future funded places. But if you're from one of the areas where a place hasn't been taken, then obviously for the March cohort coming up, we would love to get your application. We are looking to try and get applications in by Friday the 12th of January, and aiming to let people know if they've been successful by Friday the 19th of January. Obviously that is quite soon, so if you'd like to discuss an extension on this deadline, then again just contact me. And in terms of the governance for the funded places, all of the applications are taken to the Midlands Finance Academy board for approval. And in the instance that there's perhaps more than one suitable application per ICS for an intake, then the Academy board will take it to the CFOs from that system to discuss the applications further. So I hope that was helpful just to add that information onto the end. So if anyone has any questions, I think there's been possibly some movement in the chat that Emily's replying to. Emily, did you want to sort of speak about your reply there, and then it would be a chance to anyone else to either put your hand up if you want to ask a question or pop it in the chat?
Thanks, Becky. Yeah, just to reiterate that if you are a qualified accountant with 2 years work experience in the NHS, then you'll be exempt from the first diploma. You can go straight to the second diploma, i.e. choose 2 modules, so 2 certificates, and you would get 120 credits, and then you can go on to the MBA. I see a question there from Megan. Just in terms of funded places for October, it very much depends on whether they've been used up in March or not. I think the intention is to get all the places filled for March, so we can't guarantee that there will be places available in October.
Yeah, that's right. So obviously, if any of these places haven't been filled by March, then we can roll them over to October. If they have all been filled by March, like I said, sort of subject to the Academy's funding, we can't guarantee it, but we're hoping to be able to fund more Academy places in the future. So just keep in touch with me in terms of that. Is there anyone else who has any questions for either Emily or Paul or John? Thanks, Sebastian.
Yeah,
do you want to pick that up, Emily?
Yeah. The 6 years experience in the NHS will certainly help. Your best bet would be to complete an application form, and then we can go through it and review it, and then let you know if you'll be eligible to go forward. I think the other thing I just wanted to pick up, just not necessarily related here, but as I said, the time commitment is a big one for people, and that, that's quite hard to sort of think about right now when you're already probably very busy with your work and personal life as well. One of the things, we are very flexible with the approach, so you could do 1 certificate in March, and then you could think, actually, I don't want to do one in October, I will do my next one the following March, or the other way around, October and October. We are very recognise that there's a lot going on, and it is quite an undertaking, which actually once you're committed, off you go, but you can stagger your study so long as you complete within 2 years.
Thanks, Emily. Charlie, you've raised your hand.
I was just wondering, if you were at a place in your life where you've got a few ACCA exams to do, and then you could possibly apply for this, which one would you do? Or which one, or do you reckon it would be possible to do both, or just from like a professional perspective, which one would you say is best to do first?
Sure, Emily.
John, from your own experience, is that something that you'd? I mean, I've got a view, but perhaps having done your accountancy qualification as well, maybe you want to pick up that one.
I suppose for me, it's sort of almost separate side of things. So the ACCA is in effect the technical accounting qualification. It's the bit of paper. It gets you in, gets you to the interview type thing.
Yeah.
I think the HFMA side is when you're looking to develop your career and move up the ranks. I think that's when it becomes more useful.
Okay, thank you. Sorry, I've got another question.
Oh no, sorry, go ahead, Charlie.
So would you say it's definitely worth doing then, in order to give you, because I was listening to you when you were on about why you did it to get an advantage over your competitors for jobs. So you'd say it was definitely worth doing then?
Yeah, so the last set of interviews I was at, obviously I'm with a cohort of similarly qualified accountants. I know from the feedback that I scored higher in the knowledge section, which gave me a little bit of advantage, but actually if you're doing it just for that, it's not really worth it. So it was actually, my previous roles were more technical accounting. I'd had the discussions with the auditors and the regulators and filled in all the technical returns. I've managed to move over and into the more financial management side of things. So I've changed slightly to tack in my career, and I think the qualifications definitely helped me in that.
Okay, thank you.
Thanks, Charlie. And Paul, did you want to respond as well?
Yeah, it's just, I mean, although it was a long time ago, I mean, I qualified as a chartered accountant, And then, 10 years later, I did my MBA, and that really made a difference. So I then became managing director of the consortium. When I went to work for the House of Commons, it stood me out from other people, because you actually had a broader management understanding. And if you like, so I think the MBA, yes, does, but back to your original question, I think the ACCA is the important one for the technical one. And then at that stage, it does actually sort of, it's a sort of conversation starter for people, but it does show that broader understanding, which as you go further up is important. So that's why I did it. Also because I was getting very little management training in the NHS in that particular circumstance, and it forced me to do it. So that's my background to it.
Thank you.
Thank you very much, Paul and John, for both covering that question from Charlie. We are at the end of the session, so if there's any last minute questions, please just pop your hand up or pop it in the chat. Otherwise, we will end shortly. Just want to thank Emily and Paul and John for all coming on today to talk about this. I hope it's been interesting and helpful. We'll send out the slides. Also with the slides, we'll send you a link to the application form, so you've got that link directly, but my email is on the slide there, so if you want to just get in touch, then do. Also, a colleague of mine, Nick, his email is there on the slide, and he is on the call as well. I don't know if he can wave. There he is. He is sort of the font of all knowledge in terms of the qualification, and if you're just a little bit unsure about, is this right for me, or you have a few more questions that you didn't ask today, then Nick would be your man. So between myself and Nick, I'm sure we can answer anything that you have. But yeah, I'll finish there then if we don't have any more questions, and thanks everyone for joining.
Thank you.
Thanks.
Bye.